Oh, good job, good job.
Jamie Leone dotes on her 15-month-old son, Rain. She loves being a mom. But it hasn't been easy.
It was a tough pregnancy.
Jamie has battled depression all of her life, and after giving birth at 20, she became suicidal.
I would even have thoughts that maybe, like if I was gone, my kid would be okay because my mom could raise him.
Jamie's husband, Miguel, suggested she try cannabis edibles to treat her depression.
He just told me, just take a few and tell me how you feel.
Since then, Jamie has been consuming edibles several times a week. She says cannabis has helped her bond with Rain.
I feel like I have more patience with him. I'm able to be interactive with him because I'm a very quiet person.
But the concern is, Jamie is using cannabis while breastfeeding.
I think that it is perceived as being a medication or a drug that is very safe, it's very organic, and I think what we just don't know are the ill effects of that.
Dr. Erica Winemore is a neonatologist at Children's Hospital Colorado. She's leading the state's pilot study on how long THC stays in breast milk of mothers who consume cannabis.
When it is consumed into your body, it gets stored in your fat stores, and our brain and our nervous system has a lot of fat content, as well as breast milk has high fat content. So that's where our primary concern is, what are the effects on the baby's developing brain?
Some studies have indicated that there may be some cognitive consequences to the child later on in life.
The body of evidence does point to problems with cognitive development as well as behavioral problems later in childhood and in adolescence.
In this study, nursing mothers agreed to discontinue cannabis consumption for a period of 6 weeks. It's in the early stages of enrollment, but already Dr. Winemore has experienced a serious challenge.
About half of them said that they couldn't stop using marijuana, and it signals to me that we have like a public health issue if women are thinking that it's better to use marijuana and take that risk and that gamble.
It is a public health issue that concerns the state's largest county health department. In 2014, Tri-County Health quantified the number of mothers in their program for women, infants, and children who self-reported using THC before, during, and after pregnancy. Among the more than 1,700 moms surveyed, 95 admitted to consuming THC within the previous 30 days. And of those, almost 36% reported using while pregnant, about 41% after pregnancy, and nearly 14% while breastfeeding. The Colorado Department of Public Health and Environment has issued guidelines for pregnant and nursing mothers, warning, there is no known safe amount of marijuana use during pregnancy, and using while you are pregnant passes THC to your baby. The guidelines also debunk several myths about cannabis. For instance, since it's legal or used as medicine, it must be safe.
Who's there? Look, it's a penguin.
Vicki Houston moved to Colorado to use medical cannabis to alleviate pain from several health conditions.
Growl, growl, says the polar bear.
When her son Keanu was born 15 months ago, he tested positive for exposure to THC. That result landed Vicki in trouble with Teller County Social Services.
What Colorado ended up doing was charging me with abuse and neglect.
Under the Colorado Children's Code, a mother can be cited with child abuse and neglect in any case in which a child tests positive at birth for a Schedule I controlled substance. And under federal law, marijuana is a Schedule I drug. Vicki appealed her case and her record was expunged.
The fear of them possibly taking him was life-altering. And there was a point in time where I would hear a car door close, and I would wonder if this was the day that I got a knock on the door, that they were going to be taking him from me.
Health officials worry that the law dissuades mothers from telling their doctors about their use.
From a public health standpoint, that makes it more difficult for us to reach out and really try to identify moms who I suspect are struggling with other issues that we could try to help alleviate, and I think we're just really missing the boat.
Jamie has decided to be transparent with her nurse about her cannabis use and feels that the benefits she experiences outweigh potential medical and legal risks.
If there's something out there like a research that shows that it's bad for either me or my baby, I would stop. But there's nothing out there, and I think it's doing me good, so.
What I just hope is that people would have more caution to let us try to find more evidence to support what the exact effects are and be a little bit more patient before using something that could harm your child.